Let's talk a little bit about head injuries. Now, they can range from little bonks on the head all the way to life-threatening emergencies. But keep in mind, the vast majority of head injuries are going to be minor and temporary. So for superficial stuff, cuts and lacerations and scrapes, things like that, you're going to treat them just like anywhere else you would on the body with gauze, bandages. For the head, skin staplers are great for lacerations up there. A laceration on the face, it's a little more significant. That's probably something to go to the ER for, only because of scarring issues. They're gonna send in a specialist who's gonna use very fine sutures and get that to where it's a very minimal scar. But again, not a life-threatening concern at all. Signs and symptoms that are worrisome: experiencing a loss of consciousness, loss of memory, if their pupils basically look goofy, right? If they're really big, if they're really small, if one's different than the other, that's a big indicator of brain trauma. Any fluid coming out of the ears, whether it's blood or clear, definitely go to the ER. If they're dizzy, if they have memory loss, things like that, monitor that patient for those odd behaviors, that loss of consciousness, that kind of thing. That's when you're gonna wanna go in and just make sure brain-wise they're okay. They might have a little concussion, no big deal, a couple days they'll be fine. Or it could be a brain bleed, and that obviously is a big deal. You just wanna make sure everything's fine, so get in, they'll probably give you an MRI, something like that, and just, if nothing else, get some peace of mind. Those are a few things to keep in mind with head injuries, guys. Stay safe. We'll see you out there.